Hi, my name is Hannah, and today I'll be going over the surgical site infection teaching plan that I created. So some of the things that with the teaching plan you want to go over with a patient who is going home after having an abdominal, or not an abdominal surgery, just a surgery in general, is for them to know what a surgical site infection is. When they know what a surgical site infection is, it helps with them understanding, okay, that's what it is. They could possibly think it's something else. They could not be aware of what exactly it is, so it helps them with knowing what they need to look out for. And with this, you can teach them with a PowerPoint presentation. I know it's a little bit harder in the hospitals because you don't have the accessibility of getting them the presentation. You can also do a handout or a brochure, just kind of like pointing out like what it is. And then you can always do like question and answer of, do you know what it is? What is it? And then kind of ask them questions based on that. The next thing is you want to identify some ways to prevent a surgical site infection, so that way they're aware of how to prevent one. So like they want to make sure they do hand hygiene, make sure they're cleaning the wound properly, make sure they're cleaning themselves properly, maintaining a healthy diet, because diet is a part of healing, as well as maintaining antibiotics if they have any, or making sure they're keeping up on their medications. And then also no smoking. I know some people are smokers and some are not, so it's not for everyone, but it's a good way to tell them like, hey, smoking will hinder the healing ability. And then you can teach this with a lecture, a video, or a handout. And then you can do question and answer with them just to kind of quiz them on, ask questions and then make sure they answer correctly. And then identify signs and symptoms of a surgical site infection. This is just to help them understand what they're looking for specifically. So if they have a fever, or if they have pain, or if they have redness around the incision, that's, it shouldn't, when it's not a brand new surgical site, then that's when you want to go, okay, there might be an infection. That way they know and they're aware, instead of thinking, oh, well, there's redness around my incision. I had surgery a week ago. Well, it shouldn't be red anymore. So that's when they can understand. And then you can give a lecture. You can also provide video to kind of go over and have them see physically what the different signs and symptoms are. That way if they can kind of see them and then see it on themselves, they'll understand it a little bit more. And then you can also do a handout, which I actually created one. It just goes over, here, I'll hold it. It goes over like the signs and symptoms and the preventions, and then a little bit of info about when it is obtained. A lot of people think that it's obtained just after surgery, but it could be before surgery. If a complete sterile field wasn't performed, it can be performed during surgery. If a piece of equipment is contaminated, or after surgery. And then you can do an identification quiz with this, just to kind of quiz people. I created one, and what I did is I put signs and symptoms, some that could be with a surgical site infection and some that could not. That way it lets the patient identify them. And then with the answer key that I posted, along with it, it kind of goes over the rationale of why some of the infections could be associated, and why some of the symptoms and signs could not be associated. So there's rationale for all of them. And then show a proper way to change the dressing for a surgical site. You want them to demonstrate to make sure that they know that what they're changing, how they're changing it, how they're supposed to, because they could think one way is right and it might be wrong. So having them demonstrate it, make sure that they're doing everything in the proper way. And then demonstration would be the best one. And this is a teach and repeat kind of thing. So you would teach it, have them repeat it back to you. And then you want to have the patient explain what they should do if the surgical site does become infected. Some people might just let it go and say, well, it'll heal itself, my immune system will attack it, and sometimes that's not always the case. So if they are aware that, hey, I have a surgical site infection, or my surgical site is becoming infected, I need to get it taken care of. Because sometimes if they wait, by the time they get to the doctor, it might be a little too late, and just antibiotics won't work, and they might have to have surgical interventions in order to clear out the infection. So, and that's just a quiz or answer kind of thing, or question and answer, just to make sure that they understand what they're supposed to do. But that's it for surgical site infections.